So imagine like many men that are on steroids, underground testosterone, and they want to quit that and get on regular legal prescribed TRT. So how do they go about that? Do they have to stop the underground testosterone first completely to have low labs? How to go
That's a
about
this, this is a good question, Stephen. Let me approach this from two different perspectives. Okay. One, does the patient want to come in with a low testosterone so he can qualify for insurance purposes? That's a whole different ball game than a person coming in and just wanting to show their doctor that their testosterone is low enough to be placed on testosterone. So here's my point. If you've seen a doctor that tells you your testosterone isn't low enough to be on, if your testosterone isn't low enough to be on hormone optimization, you're seeing the wrong doctor. If the guy's focused on the lab value, that your numbers must be below, or he or she is going to entertain the idea of testosterone optimization therapy, you're barking up the wrong tree. The guy's looking for a number, move on, find a different doctor. Okay, now the flip side of that question is, if you want to figure out what to do to apply to qualify for insurance purposes, remember you got to have low T below a certain number, 2 random morning blood draws to qualify. That's a whole different topic. But I have the answer for you. Back to my testosterone, the Bible on testosterone, right at page 318. I found this. The researchers found out that obviously it has a lot to do with the ester. I mean, we all know that propionate has a very short half-life of 0.8 hours. So, within 2 days of using it, it's already out of your system. Enanthate is tantamount to cypionate as far as half-life. So they're synonymous. All right, enanthate, cypionate. Now, has to do, with a lot of things, how much body fat you have, how much muscle mass you have, how active you are. But there was an experiment done in this book, and I found it, and it's very interesting. Got me back into this tome. But they found out that with enanthate or cypionate, if you're on 200 mgs a week, 200 mgs, this experiment that was done, they give different men 200 mgs a week, 300 mgs a week, and 400 mgs a week. So 2, 3, 400. And they found out the on average amount of time when you're going to be subtherapeutic, right? You're going to be needing testosterone again because below baseline, is 2 weeks for the 200 mg group, 3 weeks for the 300 mg group, and 4 weeks for the 400 mg group. So it's nice the way this experiment laid out itself. If you're doing 200 mgs a week, you got to wait at least 2 weeks. Okay. 300 mgs a week, you got to wait at least 3 weeks. 400 or better, you got to wait 4 weeks. So that's your period of time with which to go in and be able to successfully qualify for testosterone therapy if you're doing underground testosterone. 2 to 3 weeks on average. Because most guys we treat are under 200. Some guys are 200. I don't see too many guys on 300 mgs a week. But again, 2 weeks for 200 mgs, 3 weeks for 300 mgs, 4 weeks for 400 mgs, and you will qualify. Got it? Straight across the board.
So that's qualifying for insurance. But what if they don't are going for insurance?
Then obviously those are obviously the numbers. Those are the times out from injection where your testosterone is going to be below baseline.
Yeah.
Okay. So if you're going to see a doctor that's going to just focus on numbers versus how you feel, move on. But in general, 2 weeks for the 200 mgs IM,
Mhm.
3 weeks for 300 mgs IM.
Okay.
You'll be able to qualify as per the physician that's going to say, yes, the testosterone is now below 300.
Yeah.
Just pull that one out. They keep moving to the left, But,
Mm.
but again, this experiment was done probably 10, 15 years ago, and it's documented that how simple, linear the relationship is.
Yeah.
2 weeks, 200 mgs, 3 weeks for 300, 4 weeks for 400. It's as simple as that.